But before that, an amazing story, actually. The medical dogs from Milton Keynes who can detect Parkinson's disease by smell.
Yeah, Peanut and Bumper, they're dogs. They've got such powerful noses, they can detect smells at concentration levels of 1 part per trillion. That's a single drop of liquid in 20 swimming pools.
Well, following a trial, both dogs were 98% accurate in detecting the disease and were even able to detect it in samples from patients who had other health conditions.
Well, Claire Guest is the Chief Executive of Medical Detection Dogs. Claire, this is quite the breakthrough, isn't it? In the trial, Bumper and Peanut, the dogs, were 98% accurate when detecting the disease. How do they smell for it?
Well, they've got an incredible sense of smell. You know, these dogs are able to detect tiny, tiny amounts of odour, and this is what they've done in detecting Parkinson's disease.
How did you go about first discovering that they could detect the disease?
Well, the charity Medical Detection Dogs has been working for many years now. We started in cancer detection. Of course, that was hugely exciting to know that dogs could detect that. But we've now gone on to detect other diseases where there's a problem in early diagnosis, and that's exactly where Parkinson's is. You know, it's a growing diagnostic. It's a growing number of people diagnosed with it. It's a terribly debilitating disease, and yet we haven't really moved forward for many, many years in being able to diagnose it early.
As you said, there's currently no early test for it, is there? So this could really break down those barriers and get those early detection rates in.
Absolutely. You know, as someone who's had a family member who sadly passed away with Parkinson's, you know, many, many years before the diagnosis was made, there were symptoms. You know, they didn't necessarily fit the whole pattern of Parkinson's early on. And this means that, you know, there are a few medications that are used early on in the disease process. If we can understand more about the disease and more about when it actually starts, then, you know, medication could be improved to try and slow the process down and improve quality of life for those people who have got the condition.
And that's what's so key, isn't it? Getting that early detection in there and making sure there is a good quality of life for those who are then diagnosed. How would it work in practice with the detection dogs? Would somebody who, say, is suspected of having Parkinson's be introduced to one of the dogs and then we go from there?
Well, in this particular case, what would happen is the same as the study. Samples would come to the dogs. Now, these are very non-invasive samples. These are samples where somebody's been given a small piece of cloth to wipe across their forehead or at the back of their neck. And the dogs are able to detect from the sebum, the oil that's in our skin, that there's a biomarker there that smells of Parkinson's. You know, in the future, probably dogs won't be the diagnostic. You know, thousands of samples won't come into dogs in the future, but the understanding of what we're doing is informing artificial intelligence. And once artificial intelligence understands the smell that the dogs are finding, this could really revolutionise the detection of Parkinson's in the future.
It really is the very beginning. Claire Guest, the Chief Executive from Medical Detection Dogs, thanks so much for sparing your time today.
Thank you.
I'm always amazed when we do stories about those dogs, what they can do.
As Claire said, they started off, you know, detecting cancer, and they go on and then they can do with just a small sample. It's just astonishing, isn't it?
Well, next...